The People's Pharmacy podcast is supported in part by CocoVia. CocoVia cocoflavanols support both cardiovascular health and cognitive function by promoting healthy blood flow, transporting oxygen and nutrients to vital organs and muscles, including your heart and brain.
CocoVia now comes in an even more concentrated formula, with 450 milligrams of cocoflavanols, 5 times more than the leading dark chocolate bar and 15 times more than the leading cocoa powder.
CocoVia has a proprietary process that preserves cocoflavanols at the highest levels, and the product undergoes rigorous testing at every stage, which allows them to guarantee the highest level of cocoflavanols per serving and to provide the purest, highest quality product possible.
People's Pharmacy listeners can now try CocoVia for 25% off by using the code Peoples25 at cocavia.com. That's CocoaVia.com. Hypothyroidism is a lot more common than most people realize. The standard treatment may not always control symptoms. This is the People's Pharmacy with Terry and Joe Graydon.
Over 100 million levothyroxine prescriptions are dispensed in the U.S. each year. For many doctors, that's the beginning and end of treating a sluggish thyroid gland. But not all patients are happy with the way they feel on levothyroxine alone. Would they do better on combination therapy?
Do other health traditions offer different approaches to treating thyroid disorders? We'll talk with a chiropractor who's incorporated Ayurvedic principles from India into her own practice.
Coming up on the People's Pharmacy, what to do if standard thyroid treatment doesn't work for you.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Today, we're talking about the treatment of hypothyroidism. According to the American Thyroid Association, roughly 20 million Americans have some sort of thyroid dysfunction. That's 12% of the population. Many are undiagnosed. Hypothyroidism is by far the most common form of thyroid problem. The name means that the thyroid gland is not functioning optimally.
Because thyroid hormones affect just about every cell in your body, when the gland is not working properly, people feel bad. Symptoms can include depression, fatigue, constipation, dry skin, hair loss, weight gain, sensitivity to cold, and muscle weakness.
For such a common condition, there's a surprising amount of controversy about the best way to diagnose and treat hypothyroidism. Today, we'll get 2 very different perspectives.
First, we turn to Dr. Antonio Bianco. He's an endocrinologist and professor in the section of endocrinology, diabetes, and metabolism at the University of Chicago Department of Medicine. He's done groundbreaking original research on the treatment of hypothyroidism. Dr. Bianco is a past president of the American Thyroid Association.
Welcome back to the People's Pharmacy, Dr. Antonio Bianco.
Thank you very much. It's a pleasure to be here talking about such an important topic as the treatment of hypothyroidism.
We couldn't agree more. We'd like to go back a little bit and get the historical perspective, if you don't mind, because for decades, the way low-acting thyroid glands were treated was with something called combination therapy. Can you tell us a little bit about that, please?
Yeah, of course. So hypothyroidism was described as a syndrome a long time ago, at the end of the 19th century. And at that time, it was not very clear how the diagnosis could be made, but in general, it was a clinical diagnosis. Soon after that, doctors realized that a failure of the thyroid gland was causing that syndrome that they described. And rapidly, they figured that they should treat with replacing thyroid gland. How did they think about doing that? So first they thought, well, let's do a thyroid transplant. And I think that's amazing that in the beginning of the 20th century, physicians were thinking actually and doing a thyroid transplant. And
how well did that work? They didn't have any of the usual tools that we would use now for a transplant.
That's right. So that's why it didn't last long. So it fixed the symptoms for a few months, 2 or 3 months, but then probably because the transplanted tissue was destroyed, it didn't continue to be effective. And then a new transplant had to be made. So it was not really practical. Then doctors said, well, how do we give the thyroid back? So they went to slaughterhouses and got thyroid tissue, thyroid glands from cows or for pigs, and they prepared like a beef, a steak of thyroid to be ingested in breakfast in the morning, warmed up. And then the treatment was very effective. So if the patients were receiving those food containing thyroid from cow or from pigs, then the symptoms would go away, and that would last for a long time. Now, it's reported that the flavor, or it didn't taste very well. So that was a problem. Again, a practical issue, although very effective, not very practical.
It didn't appeal to people, right?
Right. So at that time, they had the idea of prepare an extract of the thyroid because they figured there's something in the thyroid that's important. So let's prepare an extract, dry it up, and put it in a pill so that we can give this pill to the patient because there's no taste. And that was called what we know today as DTE, or desiccated thyroid extract. It was developed in the beginning of the 20th century. And essentially what you do is you give your patient a pill containing the thyroid. Today in the United States, the thyroid that's used is porcine, is from pigs. I don't think we manufacture, we sell cow's thyroid anymore. So from a historical perspective, how effective was this treatment? It was very effective. In fact, was the choice for treatment of hypothyroidism until 1970.
Now, Dr. Bianco, I want you to stop there for just a second, because when you say it was effective, doctors didn't have any way of determining how effective it was, except in terms of what symptoms the patient had.
That's correct.
And the symptoms that patients had at the turn of the 20th century, if they were being diagnosed, were pretty drastic. Can you tell us a little bit about that?
Right. Well, we didn't have, at that time, the doctors did not have a biochemical test, a blood test, to diagnose a failure of the thyroid gland. Therefore, they had to rely on symptoms. And of course, when you rely on symptoms, you actually can only make diagnoses on those patients that are mostly affected by the disease. The patients that have the mild hypothyroidism probably were never diagnosed at the stage that they had mild hypothyroidism. Only when the patient was really hypothyroid, lethargic, constipation, hair loss, all the symptoms we know about hypothyroidism. So that's when the doctor said, well, probably you have hypothyroidism. Let's try with the DTE, with pills of DTE. And they knew enough that they would start with a very small dose of DTE, and I'm going to explain why. And over time, that dose was increased progressively until symptoms were gone. And then the dose, again, was adjusted based on clinical symptoms and not primarily on labs.
So, Dr. Bianco, this would be considered true personalized medicine long before the term became popular.
I would agree with you. Yes, it's personalized. It was really based on what the patients were feeling.
So then what?
Well, I mean, let's think about it, because your question started with combination therapy. So what's in the thyroid? We know the thyroid makes basically two hormones, one that's called thyroxine, or T4, and the other one that's called 3-iodothyronine, or T3. And the T4 and T3 just depends on the number of iodine atoms in the molecule. So when you give someone DTE, which is the thyroid extract, you're actually giving both T4 and T3, because in the thyroid, at any given time, there's a lot of T4, but there's some T3 as well. So it's important to realize that during these 90 years, patients were treated with DTE, that is combination therapy. Because the pig's thyroid contained about a ratio of 4:1, T4 to T3, so patients were actually given a substantial amount of T3 throughout these decades.
How does that compare to humans?
Humans have a ratio of about 15:1, meaning that there's a greater excess of T4 and a much smaller amount of T3. So then what happens is, how did the doctors define when was time to stop? So they would progressively increase the dose, but up to what point? So they relied on some blood tests which were not very effective, not very sensitive. And I actually talked to some colleagues of mine that used to treat, they're old enough that they were, active in their practices before the 70s. And they said that, basically we would just go up with the dose when the patient complained of palpitation, when the patient complained of tremors or headaches. That's the time we knew we had to stop. And then we would decrease a little bit, and the patient would remain in that zone of a probably mildly thyrotoxic. Probably patients were receiving an excess of thyroid hormone. Now, how do we know that? Because in 1970, something very important happened. Dr. Robert Udiger developed the radioimmunoassay, or a method to measure TSH in the blood. And as we know, TSH is a hormone that controls the thyroid. So when the thyroid is failing, TSH levels will go up. And when there's an excess of thyroid hormone, in contrast, TSH levels in the blood will go down. So basically, starting from 1970, the diagnosis of hypothyroidism changed from essentially a clinical diagnosis to a biochemical diagnosis. So starting in 1970, we could actually measure the amount of thyroid hormone replacement was sufficient, insufficient, or was excessive, just by looking at the TSH levels in the blood. So the minute the doctors started to use the TSH as a diagnosis tool and also to adjust the dose of DTE, they realized that, in fact, we were giving too much thyroid hormone, too much DTE for the patients. As we know today, patients were receiving probably 3 or 4 times more thyroid hormone replacement than they actually needed, as judged by the TSH levels. Therefore, 1970 marked a transition in the treatment of hypothyroidism, a transition in which the diagnosis changed from a clinical to a biochemical, and the doses of thyroid hormone replacement were markedly decreased.
You're listening to Dr. Antonio Bianco. He's a professor in the section of Endocrinology, Diabetes, and Metabolism at the University of Chicago Department of Medicine. Dr. Bianco is a past president of the American Thyroid Association.
And some of the symptoms for hypothyroidism include depression, fatigue, constipation, dry skin, hair loss, weight gain, sensitivity to cold, and muscle weakness. And they're all kind of nonspecific symptoms, which is why it's not always easy to diagnose hypothyroidism.
Oh, well, a couple of other symptoms you haven't mentioned: high cholesterol, also swelling in the hands and feet, or maybe around the eyes.
After the break, Terry will tell you how her hypothyroid condition has been treated.
I've been taking one drug for almost 50 years, but not everyone does well on this standard treatment.
If people don't feel good on T4 alone, what can they do?
What is combination therapy for hypothyroidism?
And when would combination therapy be appropriate?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. KAYA Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's Kaya Biotics.com. Use the discount code PEOPLE for $10 off your first purchase. This podcast of the People's Pharmacy is brought to you in part by Thrive Cosmetics. These extra special beauty products are certified cruelty-free by PETA and Leaping Bunny. Just as important, they're formulated with ingredients that support skin health. The Bright Balance 3-in-1 cleanser leaves my face feeling wonderful, moisturized as well as clean. I love the citrus scent. And Thrive Liquid Balm Lip Treatment is terrific when my lips get chapped and dry. It makes them feel great as well as look good. Thrive Liquid Lash Extensions Mascara is a customer favorite with more than 7,000 5-star reviews online. You'll want to check it out for yourself and see how much lusher your lashes look. Thrive goes beyond business as usual. For every product purchased, Thrive Cosmetics helps women in need thrive. Donations have gone to women struggling with homelessness and to survivors of domestic abuse. Wouldn't it feel good to know your purchase helps support others who need help? Right now, you can take advantage of a special offer. Start thriving and help women in need today by going to thrivecosmetics.com/Joe and use the code JOE, J-O-E, for 15% off your first purchase. That's Thrive, Thrive, Cosmetics, CAUSE, medics.com/Joe with code JOE for 15% off. Thrivecosmetics.com/Joe, code JOE. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Grayton.
The People's Pharmacy is brought to you in part by Cocoa Via, maker of high-potency cocoa flavanol supplements that support cognitive and cardiovascular health. More information at cocovia.com.
Also by Verazana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
Today our topic is hypothyroidism. In case you thought this condition is uncommon, more than 100 million prescriptions for levothyroxine are dispensed in the U.S. each year. That doesn't include various natural products or even brand name Synthroid.
We're talking today with Dr. Antonio Bianco. He's an endocrinologist and professor in the section of endocrinology, diabetes, and metabolism at the University of Chicago Department of Medicine. He's done groundbreaking original research on the treatment of hypothyroidism. Dr. Bianco is a past president of the American Thyroid Association.
Dr. Bianco, I had no idea that my diagnosis of hypothyroidism in the early 1970s was so close to the beginning of this new era, because I was diagnosed with hypothyroidism when I was around 25 years old, and the doctor he had a high suspicion that I might be hypothyroid based on my symptoms, but he also used TSH testing, and what he prescribed was not DTE, the thyroid extract, but rather the synthetic levothyroxine known as Synthroid. How common is that?
So during the 20th century, around 1945, 1950, a lot was discovered about the thyroid gland, how the thyroid gland works, what are the hormones in the thyroid gland, and they knew around that area that T4 was the main hormone. T4 had been crystallized and its structure defined. And in 1950, another hormone was found, T3 was discovered. And they knew T3 was more potent than T4 based on animal studies that they had done in the lab. But they thought that the thyroid would produce T4 and T3. And they didn't know about the fact that T4 can actually be converted, can be transformed to T3 outside of the thyroid gland. So that's why they thought, well, by giving DTE, we're actually giving both hormones that the thyroid produces. Now, again, by coincidence, in the year of 1970, a group of doctors described for the first time that humans can actually convert T4 to T3. And that was changing the paradigm, because before we thought, well, we have to give T3. And now they discovered that by giving only T4, the hormone that's not very active.
Levothyroxine.
Exactly, levothyroxine. We can actually achieve, the body will transform levothyroxine to T3, to that hormone that's in fact very active. Therefore, by giving small amounts of levothyroxine, we would be in fact giving both hormones, T4 and T3. And more important, patients would not complain of those symptoms of the mild thyroid toxicosis by giving T4. Because, what happens some patients, when they take DTE, because it contains T3 is very rapidly absorbed, and it can cause some palpitations, some sweating, some discomfort. And by just giving levothyroxine, you don't see that happening, because the body will slowly transform T4 to T3.
And for most patients, the T4 alone seems to do pretty well.
And a lot of doctors, they just felt uncomfortable with the idea of a natural product that might not be as consistent, may not be as well produced as a pill from a laboratory. So they embraced synthetic levothyroxine, hence the name Synthroid.
But we have talked to you before about the fact that there is a significant minority of patients who don't do well on T4 alone. And you have explained to us what the basis for that might be.
Well, and when you say a minority, 15%, that's a lot of people.
It's a minority, but it is a significant minority.
Right. A few million patients. No, absolutely, you're right. So DTE had a problem. I read many reports from that time that sometimes the patients were treated with DTE, but because of the manufacturing was not very good, it had no effect. And so doctors did not trust very much DTE. Once levothyroxine became available and they learned that levothyroxine could be converted to T3 and be biologically active, it was really rapid, the transition from DTE to levothyroxine. It took about 10 years. So we start the decade of 1970 with DTE as the main form of treatment. We start the decade of 1980 with levothyroxine being the standard of care for treatment of hypothyroidism. So again, it was advantageous, no real side effects, but as you pointed out, a minority of the patients, it's hard to say how many patients, about between 10 and 15%, the patients will tell the physician. And according to my discussions with my colleagues, they said some patients told me right away, the minute they were switched to levothyroxine, they said, "Doctor, there's something wrong. I can't take this treatment. Put me back on DTE." So the doctors were sort of in a difficult position because they had patients telling them that they were unhappy. At the same time, they had all the science, all the meetings, all the marketing of the pharmaceutical companies telling them, no, this is the future. Levothyroxine is the choice.
And they had all of the greater gods of endocrinology telling them that levothyroxine.
Well, and they also had the lab test, so the TSH was normal. Do people have problems that could be detectable with a low T3 even if their TSH is normal?
Yeah, that's the question we are addressing today. So today we know that because of a lot of people's research, we know that patients, when they're treated with levothyroxine to normalize TSH in the blood, their T3 levels are not fully restored. We know that the conversion of T4 to T3 is not 100% effective, so that they will reach a normal TSH, but the T3 levels will be about 10% lower what would expect for that patient. Now, the question is this clinically relevant? 10% sounds like a small number. Is this relevant? Now, I've done studies in animals, in rats, and I mimic the situation in rats. And in fact, in rats, this 10% is very important. The rats exhibited genetic signs of hypothyroidism in many tissues because of that 10%. Now, humans is a different story. I mean, we need a clinical trial. We need the focus studies. Now, the most sensitive thing that we discovered in rats because of that 10% lower T3 was that they remained with a high cholesterol level. As you know, in hypothyroidism, cholesterol levels will go up, and when you treat patients, cholesterol levels will be normalized, will come down and be normalized. Now, I asked the question, does that happen in humans? In fact, when we treat someone with hypothyroidism, are we normalizing serum cholesterol? And in fact, the answer is probably not, because we did some studies. We found that patients on levothyroxine are more likely to be on statin, for example. Why would they be on statin? Because their cholesterol is higher. We did a meta-analysis, meaning we looked at 100 studies in which hypothyroid patients were treated with levothyroxine. And when you look at all these studies combined, in fact, those patients on levothyroxine that have normal TSH have a higher level of total cholesterol and a higher level of LDL cholesterol. Knowing that they take more statin even, probably this is it's an underestimation of how the impact of these low T3 levels is causing in the liver. So, obviously this needs to be further studied, but my hypothesis and my feeling is that patients on levothyroxine might exhibit liver hypothyroidism, meaning we are not normalizing thyroid hormone action in the liver, given that the serum cholesterol levels are slightly elevated.
Dr. Bianco, your paper, which is really quite fascinating, is titled The Swinging Pendulum in Treatment for Hypothyroidism from and Toward Combination Therapy. So it seems like you and some of your researcher colleagues are rediscovering the benefits of what we call now combination therapy, something that was used 100 years ago, but perhaps a little more sophisticated today.
Yes. So if you think the pendulum, the idea is during 90 years, we were making patients thyroid toxic. We were giving too much thyroid hormone. Now, in 1970, we changed, and now we are probably making some patients slightly hypothyroid because of the 10% low T3. And how do we fix this? I mean, the only way we know how to fix this is to give some T3 in order to normalize the T3 levels.
And the trouble with T3 is that many doctors are reluctant to give T3, partly because it is metabolized so rapidly. Patients need to take it several times a day.
Right. Normally, it's given once a day, but as you said, right after patients take a tablet, levels will go up in the blood and then rapidly metabolize so that in a few hours it's gone from the blood. So there's a recommendation to take more than one tablet per day, so the dose would be split. I had patients that were taking the tablets of T3 every 2 hours. So there's really not a clinical guideline that physicians can follow. This is really, again, customized for patients.
Now, some integrative physicians have kind of recognized what you're talking about and the idea that they have to give patients T4 plus T3, and so they're kind of going back to the old desiccated thyroid extract of 90 years ago. Others are looking for compounded thyroid, which contains both some T4 and some T3 in a kind of longer-acting formulation. What's your thought on those two different approaches?
Well, the desiccated thyroid extract contains, as we know, a relative, it's high levels of T3. And we should be careful with that every time we give T3 to a patient because T3 is rapidly absorbed and it can accelerate the heart. So many patients have heart conditions and probably are not suitable for receiving desiccated thyroid extract. Now, the compounded is complicated because the amounts that we have to wait, about a few micrograms of T4 and T3, some pharmacies have difficulty in compounding those very small amounts. In addition, I'm not aware of any study showing that the fillers of the tablets prepared by some pharmacies claiming that it's a slow-release T3, I'm not aware that there's a study showing that, in fact, it is a slow-release T3 when given to patients. They have studies in vitro, but when actually given to patients, they just have the same pharmacokinetic as T3 alone. So right now, it's a problem because we want to be able to give T3 in a way that mimics what the thyroid gland does. And we don't know how to do it. There's a problem with this rapidly absorbed T3. And in order to do a clinical trial to find out whether combination therapy is better than monotherapy, we need to have a way of normalizing T3 in the blood.
Dr. Bianco, in your article, you and your co-author also mentioned something called thyroid regenerative therapy. Can you tell us about that approach?
That's amazing. In fact, a few years ago, a group of scientists described a method to start with stem cells and create thyroid follicles in a test tube. And it's really functional thyroid tissue in the test tube. And then next step, they made a mouse hypothyroid by removing the thyroid gland, and then they transplanted those thyroid cells that were produced in the test tube into the mouse. And the mouse, the hypothyroidism went away, was fixed by this transplant. Now, we have the technology of how to do it. We know how to do it. Probably we could do it today if the ethical issues about the stem cell and transplanting humans could be figured out. But the problem is, this is a very expensive approach. And levothyroxine is not a very expensive medicine. So you really need to prove that this would be phenomenal, better than levothyroxine alone to justify the cost of this therapy. Maybe for some of these patients that are afflicted by the low T3 of the monotherapy, maybe in the future that could be feasible. So technically we can do it. I don't think practically it can be done.
Dr. Bianco, what would you recommend to a patient who says, boy, I just feel so sluggish and I've been gaining weight and my hair's falling out and I'm constipated and I have all of the symptoms of hypothyroidism and I'm receiving levothyroxine monotherapy and my doctor says my TSH levels are just fine, don't worry, be happy. What should that patient do?
Well, we know what the patients do because we asked them. In a recent survey, those patients responded and said that they changed the doctor. That some patients change 10, 15 times. They go see different doctors until they find a doctor that, number one, listens to what they're saying, and number two, tries to fix the problem. Obviously, we're simplifying things. A number of other clinical conditions can cause the very same symptoms. In my experience, the number one syndrome that mimics hypothyroidism is the menopausal syndrome. So that just gives you an example of the doctor needs to look for other conditions that could justify those symptoms. Once we exclude all those conditions, then the American Thyroid Association guidelines recommend that a trial, meaning a test with combination therapy could be done. So some doctors don't want to do that. And then I think the patient should look for a physician that's willing to help them through this pathway.
Dr. Antonio Bianco, thank you so much for talking with us again on the People's Pharmacy.
Thank you very much. It was a pleasure. And this is a subject that's near and my heart, and I really appreciate the opportunity of talking about it.
You've been listening to Dr. Antonio Bianco. He's a professor in the section of endocrinology, diabetes, and metabolism at the University of Chicago Department of Medicine. You'll find a link to his recent article on combination therapy for hypothyroidism at our website, peoplespharmacy.com.
After the break, we'll talk with an Ayurvedic practitioner, Marianne Teitelbaum, about hypothyroidism.
What do the Ayurvedic texts from centuries ago tell us about this condition?
Sometimes people continue to feel bad even though the tests say they're okay. How does Ayurvedic medicine handle this situation?
You're listening to The People's Pharmacy with Joe and Terry Graydon. This People's Pharmacy podcast is brought to you in part by Verazana.com.
Verazana Lab offers home health tests that allow you to monitor your hormones and health conditions. You can take control of the quantitative assessment of your health and learn about male and female hormone balance, the stress hormone cortisol, leaky gut, gluten intolerance, or your gut microbiome.
Take a more active role in tracking your health and take 20% off your first order of a mail-in testing opportunity with the discount code PEOPLE. That's PEOPLE, all uppercase. To learn more, go to Verazana.com. That's Verisana.com. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by CocoVia, offering plant-based nutrients in the form of cocoa flavanols for brain and heart health. Online at cocovia.com.
And by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. KAYA Biotics.com.
Not everyone with hypothyroidism is happy with the standard treatment. Some people may be looking for other approaches. One possible perspective comes from the ancient Indian medical tradition called Ayurveda. Diagnostic techniques and categories are different from those in standard Western medicine, and so are the treatments, which may rely heavily on diet and herbs.
We turn now to Dr. Marianne Teitelbaum. She's been incorporating the principles of Ayurveda in her practice for over 30 years. Her latest book is Healing the Thyroid with Ayurveda, Natural Treatments for Hashimoto's, Hypothyroidism, and Hyperthyroidism.
Welcome to the People's Pharmacy, Dr. Marianne Teitelbaum.
Thank you for having me.
Dr. Teitelbaum, there is an enormous amount of thyroid disease in this country, and we think of it as a recent phenomenon. But in fact, humans apparently have been suffering from thyroid disorders for perhaps millennia. Can you tell us how this shows up in some of the ancient Ayurvedic texts that you have studied?
They didn't describe it the way we look at it today. They might have just described different imbalances, which they called Udana Vata or a Vata imbalance. That has to do with when the person might be kind of hyper and it weakens the glandular system. So it wasn't discussed the way we talk about it today. In fact, you might not find so many references to the endocrine system in the Ayurvedic texts as much as the underlying reason why the endocrine system gets weakened with too much vata or too much hyperactivity in the body, weakening the thyroid gland. So, according to the ancient Ayurvedic texts, the thyroid is more of a victim of too much activity in the body.
Now, you have been incorporating the principles of Ayurveda for quite a long time in your practice. Tell us a little bit about how you got interested in Ayurvedic medicine and a little bit about your practice as a doctor of chiropractic.
I became interested in Eastern studies when I had learned meditation in the very early 1970s. But at that point, Ayurveda hadn't come to our shores yet. But by the late 1970s, I had just heard of the word, and it kind of piqued my interest, especially during that time. I was having ill health myself and trying to go from doctor to doctor to see what was wrong with me, and always being told after several tests that nothing, in fact, was wrong with me. And it wasn't until Ayurveda did manage to come to the United States in the early 1980s, and I sat down and started studying with doctors from India, that I could see why I wasn't able to be diagnosed by anyone in America. I didn't have a disease, and doctors in America are trained to diagnose and treat disease. And here, this tradition is saying there's many stages of imbalances that happen before an actual disease will prevent. So according to the Ayurvedic tradition, I had many imbalances which were weakening my physiology, but according to Western allopathic medicine, I was perfectly fine.
So what kinds of imbalances did it turn out to be? You're well now, are you?
Yes, I'm very well now. I have radiant health, but I didn't as a youth because I grew up on the standard American diet, which is filled with toxic, so many different foods, bad oils, processed foods. And in America, when we're sick, we usually think that we need to see a doctor and take pharmaceuticals. So I grew up on antibiotics, which weakened my friendly bacteria in the gut, so I had lack of absorption of nutrients as a result of that. Also from improper diet and too many toxins through pharmaceuticals, my liver was not functioning up to par, and the liver has hundreds of functions in the body. So even though there isn't a disease in the liver, just by overwhelming it with so many toxins through the diet and pharmaceuticals, many people, including myself, will suffer consequences of weakness in the liver, congestion, toxicity in the liver. And it wasn't until I figured out how to clean the liver, balance it out, that my health came back. But again, I didn't have a disease that could be diagnosed.
Is that the explanation for why so many of us have thyroid problems now?
Yes. Again, you could think of the thyroid as the victim. The thyroid is a very delicate, I kind of consider it like a flower. And if anything is wrong anywhere in the physiology, it will become weak. So we can't say that, I have this thyroid problem, as much as we need to shift our emphasis and think that I have several things wrong in my physiology that need to be addressed, what we call imbalances, maybe not diseases, but imbalances that need to be fixed, proper diet, proper cleansing techniques, early bedtime, and so forth, and the thyroid will perk right back up.
Dr. Teitelbaum, I think a lot of people can relate to your experience of not feeling well and being told that you're perfectly fine.
Yes.
A lot of people who actually have thyroid problems can relate to that. Could you tell us, please, about your patient, Judy, and how the two of you got her back into balance?
Judy is one of hundreds that I've seen where throughout her life she exhibited certain thyroid symptoms, such as weight gain, hair loss, constipation, depression, fatigue. And yet when she would have her blood work drawn, it would come back normal. So she was told nothing's wrong with her. And usually when doctors can't find anything wrong with you, they automatically think you're depressed. So they put her on an antidepressant, and she gained 40 pounds as a side effect. So this is the very common patient that I will see in my practice every day. So again, it just stems from the fact that doctors think we're either healthy or sick. There's no in between. But according to the ancient doctors of India, we go through 6 stages of a disease process as we work our way towards a disease that can be diagnosed. So many of us are in those early stages of the disease process, and it will go undiagnosed by modern medicine.
How did you treat Judy, and how did she regain her health?
What I have to do with any patient, and including Judy, is to see in that particular patient what is out of balance. So in her case, which will be different than all the other thyroid cases I treat, she had weakness in the thyroid gland because she had taken some antibiotics when she was younger, and it was weakening her friendly bacteria. Her liver was very congested from improper diet. She was going to bed too late, which weakens the thyroid gland. And as a result, the thyroid gland can't fully function because the thyroid hormone itself cannot be used in the body until it gets inside the cell. So it has to be activated. And what activates it are the friendly bacteria in the gut and the liver. So in her case, like so many cases I see, the liver and gut are very compromised nowadays. And as a result, the thyroid hormone can't exert its influence inside the cell. So you're making hormones, it looks good on blood work, but the hormones aren't effective.
We have asked many endocrinologists over the years, why is there such an epidemic of sluggish, in other words, thyroid disorder in the United States? It's like one of the most commonly diagnosed and treated conditions there is. Any ideas?
Oh, yes, I know exactly why. And again, the answer is it's slightly different for each person, and it's pretty rare that it would just be one reason, but I can show you some of the reasons. One reason is that most of us are in a state of constant fight or flight. In Ayurvedic terminology, we would call this in a state of too much vata. Vata, again, is the element in nature of activity, movement. So too much movement, multitasking, rushing through the day, going to bed late, having irregular meal times and bedtimes will put the body in the state of fight or flight. When you're in fight or flight mode, the adrenal glands release cortisol. And once cortisol is constantly released on a daily basis, it weakens the thyroid gland. That's right there a big, big piece of the puzzle as to why there's a huge epidemic of thyroid problems. Another big problem is that 60% of the country puts fluoride in the water. Fluoride is a poison to the thyroid gland. In fact, it used to be used to kill a thyroid gland when it was hyper. They used it to try to take the thyroid down when it was hyperthyroid, but it worked so well it killed the thyroid gland. So they stopped doing that, but then they put it in the water supply in about 60% of the country. So many people feel that it could be partly due to this fluoridation of the water that is maybe part of the reason that we have this big epidemic of thyroid problems. I would have to agree there, too, because the thyroid will take the fluoride up just the same way it's programmed to take iodine up.
Dr. Teitelbaum, you have suggested that there's a strong connection between gallbladder function and thyroid function, and these two organs are in completely different parts of the body, completely different organ systems. How could they be connected?
In my 30-plus years of practice, I've treated so many thousands of thyroid cases, and whenever I see thyroid, I always see gallbladder together. They go out of balance together. So I checked the research, and sure enough, the research was there showing that whenever the thyroid is weak, the sphincter that squirts the bile, it's called the sphincter of Oddi, it will not work. So the bile is retained in the gallbladder. And when the gallbladder is not squirting bile, it opens up another whole can of worms that can happen because the gallbladder controls many, many processes in the body as well.
One of the concerns that actually has come up now in allopathic medicine, because researchers have identified it as a problem, not everyone is extremely efficient at converting levothyroxine T4 to triiodothyronine T3, which is actually the hormone that does all the heavy lifting in the body. What does Ayurveda have to offer for a problem with that conversion?
Lots. That's all I can tell you. A lot of things. First of all, that conversion of T4. T4 means that there's a molecule of tyrosine, that's where the T comes from, with 4 iodines attached. That molecule of T4 just circulates around the body, and when thyroid hormone is called for, then the T4 has to be converted to T3 because T4 can't enter your cells. But to convert from T4 to T3, many things have to happen. So think of this. One thing is 80% of that conversion occurs from your liver. So if your liver's congested or toxic, which 99.999% of my patients are in that state when I first see them. Or if your friendly bacteria are missing, 20% of that conversion occurs with the friendly bacteria in the gut. So again, if you've ever taken any kinds of medications like antibiotics, birth control pills, immunizations, or proton pump inhibitors, those friendly bacteria are severely depleted. So right off the bat there, that's 80 and 20% of the conversion of T4 to T3. The other thing is that there are nutrients that aid in the conversion, such as B12 and iron. We're seeing many patients who are vegans. That means they want to be vegetarian but not have any animal protein in the diet. The ancient doctors of India who were strict vegetarians said this: you need something from an animal at almost every meal. So if you're a vegetarian, you won't want to kill the animal to get the protein. You would have to resort to the use of milk and milk products. In this modern era, because everyone's gut and liver is so congested from so many pharmaceuticals and compromised, no one can digest milk anymore. There's so much lactose intolerance. So many of our patients want to be vegetarian. They're avoiding milk, and now they can't make enough thyroid hormone. So that's another big source of thyroid problems. And many of those patients will go low in iron and in B12. So your thyroid cannot work if your iron's low or B12 is low. And then there's others from there. Vitamin D is low, it can't work, and vitamin A, selenium, and iodine, and so forth. We have several herbs in Ayurveda that are wonderful.
You said there are herbs to support the thyroid gland. What herbs are they?
The main one we use in Ayurveda is called ashwagandha. So that one supports also the adrenal glands. And the way it helps the thyroid gland is it helps when you're under stress to prevent the release of cortisol from the adrenal glands, because the cortisol is going to shut down the thyroid gland. So that's one way of treating it. There are others. One is called shilajit. It's actually a mineral pitch that's scraped off the rocks in the Himalayan mountains. That's very, very good for thyroid and all the glandular function of the whole body. And so we give that a lot as well. There are others that are little side notes, but these are the two main herbs that we use in Ayurveda for supporting the thyroid gland.
So in summing up, Dr. Teitelbaum, how can people prevent thyroid problems in the first place? And if they suspect that something is not quite right, how can they get into balance again?
I would always try to go to bed early. The ancient doctors said no later than 10 p.m. After 10 p.m., they said it would weaken the glandular system, and we know that's correct. If you go to bed 2 in the morning and wake up at 10 in the morning, you're going to feel groggy and tired all day, even though you got 8 hours of sleep. So for the ancient doctors, 10 was the cutoff time, and some people need to go to bed earlier. The other thing is eat as healthy as you can, learn what a good diet means, and don't rush through the day. Now that you know that fluoride isn't good for the thyroid, in fact, it's a poison to the thyroid, try to drink good natural spring water without fluoride in it. And if you do have to get flu shots and other immunizations, ask for the mercury-free. So that's a lot that you can do right there for the thyroid.
Dr. Marianne Teitelbaum, thank you so much for talking with us on the People's Pharmacy today.
You're welcome. Thanks for having me.
You've been listening to Dr. Marianne Teitelbaum. She's been incorporating the principles of Ayurveda, a 5,000-year-old tradition of holistic medicine that comes from India, in her chiropractic practice for over 30 years. Her latest book is Healing the Thyroid with Ayurveda, Natural Treatments for Hashimoto's, Hypothyroidism, and Hyperthyroidism.
Earlier in the show, we spoke with Dr. Antonio Bianco. He's an endocrinologist and professor in the section of endocrinology, diabetes, and metabolism at the University of Chicago Department of Medicine. He's done groundbreaking original research on the treatment of hypothyroidism. Dr. Bianco is a past president of the American Thyroid Association.
And we have a link to his latest research on combination therapy at peoplespharmacy.com.
Lynn Siegel produced today's show. Al Wadarsky engineered. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is brought to you in part by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
And by Cocoa Via, the maker of high-potency cocoa flavanol supplements that support cognitive and cardiovascular health. More information at cocovia.com.
And by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. KAYA Biotics.com.
If you'd like to purchase a CD of today's show or any other People's Pharmacy broadcast, you can find out how by calling 800-732-2334. Today's show is number 1196. You can also order it online at peoplespharmacy.com.
When you visit our site, you can share your thoughts about today's show. We have a free e-guide to thyroid hormones available through a link from our website. Just look in our Health e-guide section.
At peoplespharmacy.com, you can sign up for our free online newsletter or subscribe to the free podcast of the show. Never miss another episode. You can share it with a friend.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.